What made you choose to become a plastic surgeon?
So I knew I always wanted to do surgery, and I rotated through the plastic surgery service, and I just love the idea of restoring form and function. I like the idea of operating on children, adults, and older adults, and helping them with both reconstructive and cosmetic issues. Being able to take care of them throughout a lifetime, both with cosmetic issues and reconstructive issues, and helping them restore their form and function, and helping them to feel better about themselves.
Where did you go to college and what did you major in?
So I went to the University of Pennsylvania and I majored in anthropology, and I did a specialty in human growth and development. I also did a nutrition minor while I was there, and I think that education helped me to not only become a physician, but as a practicing plastic surgeon, it really helps me to understand the whole patient from beginning to end, from nutrition. It helps me with their preoperative, postoperative, and recovery with the whole picture of the patient.
Where did you go to medical school?
I went to medical school at George Washington University in Washington, D.C., and I loved my experience there. I was able to do all of the specialties, rotate through surgery, plastic surgery, and that's where I ultimately decided to become a plastic surgeon.
Where did you do your residency?
So I did 2 residencies, actually. I did my general surgery residency first, straight out of medical school. I did 6 years of general surgery while I was at NYU in Manhattan. One of the years during that was a research year where I focused on wound healing and plastic surgery within the Department of Plastic Surgery, and the remaining 5 years was all clinical general surgery training. I then went to the Cleveland Clinic where I did 2 additional years specializing in plastic and reconstructive surgery, and then I did a cosmetic fellowship at New York Eye and Ear Infirmary where I just solidified and rounded out my education in plastic surgery and cosmetic surgery.
What is one of your favorite procedures?
So one of my favorite procedures to do is a mommy makeover, and the reason I like it is because it encompasses multiple different procedures on basically any female. You don't actually have to be a mother to have a mommy makeover. It's just body contouring. So it's some procedure on the breasts, which can be a lift, a reduction, or even an augmentation with implants, as well as a lift. And there's something done in the midsection, which can be liposuction, a combination of a tummy tuck with liposuction, or even a circumferential belt lipectomy or body lift with the breast augmentation. So it really does the whole center section of the body. That's what I like about it.
Do you ever get nervous prior to performing a procedure?
I wouldn't say that I get nervous before a procedure, but I always am very intently focused before I go into a procedure, starting several days before, preparing for the procedure, looking at the patient photos, reviewing the chart, talking about goals that I discussed with the patient, whether it's a breast reduction or a tummy tuck or a facelift, going over what we discussed, reviewing the chart, and then going into the operating room. I always feel very prepared because I always prepared ahead of time for what instruments I need, what assistance I'm going to have in the operating room. So by the time I get into the operating room, it's a very calm and serene place where I just enjoy myself, perform the procedure, and I know at the end the patient's going to be happy because everything was well planned out.
If you could be any other type of surgeon, what would it be and why?
I think I would be an orthopedic surgeon, maybe focusing on children, so maybe doing pediatric orthopedics, because there is kind of a lot of overlap in plastic surgery and orthopedics. We both do hand surgery, and along the lines of restoring form and function, you're taking something that's broken or malaligned or torn as in a tendon and repairing it, and then you're seeing the functional improvement over time, even immediately, but over time, with that person recovering their function of that extremity, their finger, their hand, or their leg. So I think orthopedics.
What do you like to do when you are not doing surgery?
So I'm naturally a people person, so I enjoy being around other people, whether it's my family, my friends, colleagues. So I enjoy anything that's like a group activity. I love being outdoors. I love getting a little sunlight. Of course, I wear sunscreen, but I love exercising, staying active. I love the endorphin rush of exercising. And so anything outdoors with people that I like being with is a bonus.
With your busy schedule, what are some tips to help with time management?
That's an excellent question because I do have 3 offices, Babylon, Great Neck, and Manhattan, and I operate at 9 different facilities, so it does seem a little bit busy, and I'm in different places every day. So I always think that the best thing for time management is to look at your schedule 1 to 2 days in advance, think about where you have to be and how much time it's going to take you to get there. Additionally, I also set aside time to not only do whatever it is I'm doing, whether it's surgery or an activity, and then put a little bit of a buffer on either side in case that activity or surgery takes a little bit longer.
Why should patients choose you as their plastic surgeon?
So I think for several different reasons. I think that a patient has to make a personal connection with you, and patients tell me that they feel very comfortable once they meet me. They almost feel as if we're friends. We not only talk about medical, but we talk about personal things. So I think first and foremost, you have to feel comfortable with your doctor, and patients tell me that they feel comfortable with me. So I think that's one thing. The second is the training. So of course you should go to a board certified plastic surgeon, which I am. I'm also a board certified general surgeon, and I have very good training, Ivy League education, 2 residencies at very esteemed places, NYU and Cleveland Clinic, and a specialty in cosmetic surgery. And I think that the third thing has to do with experience. So I'm experienced over 10 years in practice, as well as keeping up with the most current new techniques, new procedures, and basically the new articles and all of the new research that's going on. I attend meetings on an annual basis and keep up with my CME credits. So I feel that you need to go to someone who's constantly learning. If you liked this video, follow me on social media for more informational videos and surgical videos, and call the number below to become a patient. We look forward to meeting you.